All right, everyone. I have the unfortunate news for Derrius Guice that he actually tore his ACL and not his MCL. So what does this mean for him? As you can tell, even though he was on the sidelines joking, not worrying much about it, that doesn't necessarily translate to him having a good diagnosis. So people think, oh, he must be fine. He's doing okay in the sidelines. Well, this exactly shows you that you can't predict medicine. You can't predict that. If I was examining his knee on the sideline with a couple tests like a Lockman's or an anterior drawer, I'd be able to tell you that there was some laxity in there. There's a little too much give, and which is one of the reasons why they got an MRI. Sometimes it's so subtle that you can't see it, and sometimes the ACL is so torn that the knee swells up like a balloon and you can't even walk on it. So can you live without an ACL? Yes. Do you have to have it to live a normal life? No. If you want to run, if you want to be a professional football player, unfortunately you have to have it. Why? Because you can't cut, run, jump, and quickly change directions without it. So the surgeons, I'm not a surgeon, the surgeons have pretty much perfected this technique. It's an ACL reconstruction surgery. It's 94% effective. There's a 6% re-tear rate. Usually they use either the patellar tendon, which is the tendon coming up here for the graft. Sometimes they'll use this is quad tendon, this is patellar tendon. Sometimes they will use an Achilles. Sometimes they use a hamstring tendon. So they have plenty of options. And the surgery is about 9 to 11 months to fully appropriately return to play. Some people return in say 6 months, like an Adrian Peterson, but not everybody can do that, and that's not recommended for most people. He'll be probably getting his surgery in the next week or two after confirmation of diagnosis, and then he will have a long road of recovery. Unfortunately, a lost year for Redskins rookie running back Derrius Guice. So that's the unfortunate news for you guys. If you have any questions or comments, feel free to either post on the link at the bottom or send me a message on Twitter at Dr. Jesse Morse. All right, see you soon.